Hello everyone, welcome back to our YouTube channel Dental Mnemonics, the channel where learning is smart and fun. Today we are diving into a super important topic for both exam and clinical practice. Eruption sequence of primary and permanent teeth. And this video is extra special. It was requested by a periodontic resident, so a big shout out to you for inspiring this content. I promise that by the end of this video, you will never forget the eruption dates again, thanks to some very simple and unique mnemonics. So let's start with the primary teeth or the baby teeth. So to begin, I want you to visualize a neonate, a newborn baby. So we see here a neonate, and just for like a quick fact, like Riga-Fede disease is a traumatic ulcerative condition often seen in neonates caused by repetitive trauma from natal or neonatal teeth against the tongue. So remember, we are starting with a newborn, a neonate for the baby teeth. So here comes our first mnemonic. Like neonate begins with the letter N and neonate stands for 9. So we start with 9, 10, 11, which is N, X and I. So let's elaborate it. So 9 for N, and X is the Roman numeral for 10, and I comes from XI, which is the Roman numeral for 11. So NXI. So our mnemonic will be NXI, representing the number 9, 10 and 11, which will be our magic eruption month. So let's start with eruption date of primary teeth in months. So first we write the N, then we write the X, and then we write the I. And remember, this NXI, we wrote all of this in lowercase, not in the uppercase. And also remember this, like whenever we are climbing up, like it takes more effort, so we skip one number. But when we come down or we move forward, it's comparatively more easier, right? So we just go to the next one without skipping any number. So this trick will really come handy when we are filling up this gap. So we all know the first tooth to erupt in the oral cavity is the mandibular central incisor, which is this part. So, and we know that it usually pops in around 6 months of age, right? So baby's first tooth erupts at 6 months. So now next step, like since we are going up, and we can see here, so we skip one digit, so we skip the 7 and we write the 8. So now we are going straight. So whenever we are going straight, it's comparatively more easier, so we don't skip the number. So we write here 9. Again we are coming down, so we continue. So our number will be 10. Now see this path, it's kind of more steep, right? So this time, like rather skipping just one digit, we skip the 2 digit. So we skip 11, we skip 12, and then we come to number 13. Okay, so now continuing, we are again coming down, so it's easier. So again we write 14. So again he has to go upward, right? So whenever he's going up, again we skip one digit, so we skip 15 and we come to 16. Okay, now again we are coming down, so it's easier path, 17. Now see here, this path is comparatively more longer, right? So he needs to invest more energy. So here he skips 5 digits, so straight away from 17 we come to the number 23. And to memorize this, like here's 13, so just replace this 1 with 2 and 23. So now coming to the last step, like since he has already invested a lot of energy here, so when he's going up, like he's very tired, so instead of just missing one number, we skip 2 digit, so we skip 24 and we also skip 25. So our ending number will be 26. So you can also remember this number 6, 16, 26. 6 plus 10, 16, 16 plus 10, 26, and here 13 plus 10, 23. Okay, so let's revise this. We know the first tooth to erupt in primary teeth is the mandibular central incisor, which erupts at 6 months. So now just follow the trick. Like whenever we are going up, we skip 1, we skip 7, we write 8, we are going straight, 8 is followed by 9, we go down, again it's easy path, 9 followed by 10. Here the path is very steep, so here is also going up. So instead of skipping one number, we skip two numbers. So we skip 11, we skip 12, then we come to 13. Now again following, since going down is easier, 13 followed by 14, again is going up, we skip 15, comes 16, coming down, so we don't skip 17, and here the path is very long, and 13 plus 10 23, so we skip 5 digit and we come to 23. And here, since he has already followed a long path, like he has to invest more energy while going up, so instead of skipping just one number, we skip the 2 digits. So we skip 24, we skip 25, and we come to 26. So hope this makes it clear for the eruption date of primary teeth, and all of these are in months. So talking about eruption pattern of primary teeth, the first tooth to erupt, we know that is the central incisor or tooth number A, followed by lateral incisor, tooth number B, then first molar, tooth number D, canine, tooth number C, and second molar or tooth number E. So our eruption pattern is A, B, D, C, E. Okay, so to summarize for our primary teeth or the baby teeth, like here is our eruption date in months, and I've extracted this from the NXI table which we draw. So I hope this makes it clear for the baby teeth. So now moving on to the permanent teeth or the main teeth. So this time our mnemonic will be, like, since permanent teeth is the main teeth, so our mnemonic is main. We write MAIN. And note, for our primary teeth we all wrote the NXI in lowercase, but since permanent teeth is the main teeth, so we write this now in all in capital letters or uppercase. So yeah, for primary teeth NXI in lowercase, because primary teeth, we remember the neonate starts with N or 9, 10, and XI 11, so NXI. Whereas for permanent teeth, it's the main teeth, we write this in uppercase. So for primary teeth lowercase, permanent teeth uppercase. And also, like for primary teeth, we thought of a baby or a neonate, right? So for permanent teeth, like, let's picture a girl who has just turned into sweet 16, a memorable age. So from that 16 we get our core number. So here 16 is not 16 but 6 plus 10 is 16. So 16, 6 and 10. So we write first 6 and 10, then we add 0 to 6, 1 to 10 to get 11, and then we add 11 plus 6 to get 17. So this will be our magic number when we are decoding our eruption date and sequence for permanent teeth. So just to repeat, 16, 6 plus 10, so 6 and 10, then we add 0 to 6 and we add 1 to 10 to get 11, and then we add both of the number, that is 11 plus 6 to get 17. So our magic number for permanent teeth will be 6, 10, 6, 11 and 17. Okay, so again for the permanent teeth or the main teeth, so we write main in capital letter. So here we go, we write the M, then we write a strange kind of a in capital letter. Okay, A, then we write the I, and then we write capital N. Okay, we wrote this. Okay, so again let's recall our magic number. Our magic number was 6, 10, 6, 11 and 17. So what does this mean is that, like, the starting of M will be 6, the starting of A will be 10, the starting of I will be again 6, and the starting of N will be 11, and we end our N with 17. And this is really common sense, right? Because we know the first tooth to erupt in permanent teeth is the mandibular first molar, followed by the mandibular central incisor. So just let's write our magic number. So our M, it has to begin with 6, A begins with 10, I again begins with 6, and both the mandibular first molar and maxillary first molar is kind of synchronous, so we write both 6 together, and now n has to begin with 11 and n has to end with 17. Okay, so now rest of the number is kind of just common sense, because since a begins with 10, so m has to end with 9, right? So we here write 9. Okay, so now our missing numbers are 7 and 8. So just remember like this. So lucky number 7, so we write 7 twice, 7 here and 7 here. So now we just have to fill in the blank, that is the number 8. Okay, so now for number 10, the 10 is written as TEN, right? 3 digits. So we have to write 10 thrice. So here 1, 10, and here the other 10, but this time it's 10 and a half, 10 and a half or 10. Okay, so we have used 310. Okay, now see, like n begins with 11, so we cannot proceed bigger than 11, right? So we cannot write here 12. So rest of the fill in the blank will be both 11. So we write 11 here and we write 11 here. Okay, now coming to the last part. So we follow our number, like 11 is followed by 12, and similarly for I, like since it was a straight line, so we copied the number, right? 6 and 6. So we do this same for the ending of n. So this is like the ending part of I, so we write 17 here, and 17 is already ended upward. So let's just repeat it. First we write capital M, the capital A, a strange kind of a unique A, then I, and capital N. And then we remember our magic number, since permanent teeth is sweet 16. So 6, 10, 6 plus 0, and then 10 plus 1, 11, and 11 plus 6, 17. Okay, and then like lucky number 7, we repeat it twice, like since 10 begins with, A begins with 10, so m has to end with 9, so we end with 9. Fill in the blank was just 8. For 10, TEN, so 10 has to be repeated thrice, 1, 2, 3, and then since n it begins with 11, so we cannot proceed greater than 11 here, so we fill in this blank with 11 and 11, but here we can write 12, right? So 11 is followed by 12, and our ending digit was 17. And similarly for I, we wrote both 6 and a 6, so similarly for the ending of n, we write 17 and 17. So this is the summary which I have extracted for the previous slide for eruption date of permanent teeth in years. And note, for primary teeth the date was in month, and for permanent teeth it is in years. So now let's discuss the eruption sequence of permanent teeth. So first we write the number 3, 4, and 5, and this is for mandible teeth. So now like for maxilla, so like what can be the greater number 3, 4, 5 beginning with the number 4? So it could be either 435 or 453, right? But since 453 is greater than 435, like this will be for maxilla. So just remember maximum for maxilla. So we will not use the 435, but instead we will use 453 for maxilla. So I'm telling this because like eruption sequence of permanent teeth is quite similar in both mandibular and maxillary arts, except that in between like 3, 4, 5 is jumbled out. In mandible we just write the 3, 4, 5, but in maxilla like it has to be a number greater but beginning with the number 4. So it cannot be 543, it has to begin with 4. So it's either 435 or 453, but for since max, like maximum equals to maxilla, so the number is 453. So let's summarize this. So for mandibular teeth it's 6, 1, 2, 3, 4, 5, 7, 8. So now for maxilla it will be all same, however we will jumble this. So instead of 3, 4, 5 we will write 4, 5, 3. So our numbers will be for maxilla is 6, 1, 2, 4, 5, 3, 7, 8. So I hope this makes it clear. And like just a quick note, like eruption sequence may vary slightly across different sources including textbook and dental atlases. However, the dates and pattern that we have shared are aligned with the ADA, American Dental Association guidelines. So don't forget to do either +2 or +3 years or month for both primary and permanent teeth. So before I end the video, here's a general rule of tooth eruption, like mandible is greater than maxilla. So in general, mandibular teeth erupts earlier than their maxillary counterparts. And talking about gender, female is greater than male. So how to remember this? Like in first, man is greater, in second, female is greater. So mandible erupts before maxilla. And talking in gender, like tooth eruption tends to occur earlier in female compared to male. And there's this symmetry rule which says that teeth erupts usually in pairs, that is left and right tooth erupt like synchronously at the same time. And our fourth rule is 2/3 rule, which says that a permanent tooth typically starts to erupt when about 2/3 or 66% of the root is formed. So this means that root doesn't have to be fully developed. Like eruption begins once it has roughly covered 2/3 part of its completion. So let's do this summary or wrap up for our mnemonic for our baby teeth. So our starting clue, like baby teeth, remember the neonate or Riga-Fede disease. So neonate begins with N, so N for 9, so we write 9, 10 and 11 all in lowercase. So N is for 9, X is Roman numeral 10 and XI is Roman numeral 11. So NXI was the mnemonic, and we know first to erupt for baby teeth is the mandibular central incisor or A, which erupts at 6 months. So sequence of eruption was A, B, D, C, E. And like there was a helpful analogy when we did the NXI part, like climbing up takes more energy. So whenever you are climbing up, we skip one number. Coming down or going straight is more easier, so we just continue with our number. And we inserted one clinical fact, which is the Riga-Fede disease, which we see in neonates with natal or neonatal teeth, which causes tongue trauma. So now summing up for permanent teeth, like for baby teeth it was NXI all in lowercase, and for permanent teeth it's also called the main teeth. So our mnemonic is main all in uppercase. And our magic number, like for neonate it was for baby teeth, sweet 16 for permanent teeth. So sweet 16, 6 and 10. So what we did, first we wrote the 6 and 10, then we added 0 to 6, and then we added 1 to 10 to get 6 and 11, and then we added those 11 and 6 to get 17. So our magic numbers were 6, 10, 6, 11 and 17. And we know the first to erupt is the mandibular first molar, which is at 6 years, followed by mandibular central incisor. So then talking about the eruption sequence, like 3, 4, 5, we wrote that sequentially for mandible, and for maxilla it has to be that number greater but starting with the number 4. So it cannot be 435, it has to be 453 because max for maxilla. So that's the eruption sequence for mandibular teeth and maxillary teeth. So that's a wrap. I hope this video was very useful, like a complete easy to remember guide for the eruption date and sequence of primary and permanent teeth just by using smart and memorable mnemonic. If this video helped you, please do smash that like button, subscribe to our channel and share this with your friends or classmates. If you have more topic requests, drop them in the comment section below. The description box has all the links and additional notes that you may find useful. So until next time, goodbye and take care.